Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. And today I'm very, very pleased to welcome Khaleela Umheni out of Texas. Khaleela is the founder and principal legal nurse consultant at Veritas Legal Nurse Consultants. She's also a certified operating room nurse. Khaleela specializes in safety, medical record analysis, and quality improvement. And she says that in addition to her clinical expertise, she has been an educator for several years, training nurses and healthcare teams on patient safety, surgical procedures, and regulatory standards. And let's start with the first question. Why are you a nurse?
Well, I became a nurse actually at the age of 21 years old, very young. Um, Actually, growing up, I had a aunt. She was an LVN, and she took me everywhere. She took me to the nursing homes. She took me to the hospital. I volunteered. And so pretty much before I even graduated from high school, I knew that I was going to be a nurse. So immediately from there, I went on to just straight out of high school, got accepted to a few colleges and went straight through. Most people don't finish their nursing degree in 4 years, but I went in and I just got it done. I got it done. So I was definitely probably the youngest nurse on the unit working.
So she groomed you. She saw you and she's this is gonna follow me.
Yes, yes. I was like, and I loved it. I loved going to the nursing homes. I mean, pretty much all I did was there was help feed people. And so and then shadowing her when she was in the hospital, and I just always wanted to care for the people.
So, here's the thing though. It's one thing to, as a young person, to watch someone else do it. And this someone is someone who's close to you and someone you admire and look up to and all of that. And you get to see them kind of like function in their environment. But it's quite another thing for you to be that person. So
Mhm.
what challenged you?
What challenged me in nursing?
Hmm.
Okay. So definitely for challenging when you're 21 years old and becoming a nurse. It did
Hmm.
take a lot of growing up to do it, but I was prepared. I was pretty mature for a 21-year-old. So that was definitely challenging. And then one thing I did when I first went to, I was like, man, these people are really sick. I think they really need a lot of help. And so I basically developed relationships with the nurses around me, learned as much as I could, and to better be able to better take care of the patients that we were serving. So that was definitely challenging in the earlier part. Now, 15 plus years into nursing, um, it's different challenges. It's more of now being a leadership, now being an educator, being legal nurse consulting, seeing the stresses and the demands on the healthcare system in general. Um, for me, it's challenging to, strike the balance between, you know, making sure our nurses are taken care of, and then also giving the best care to our patients. So to
Yeah.
me, I think that's the challenge that I see now. But I think if, we continue to look at it, continue to use evidence-based practice, that we can achieve both.
And I think our challenges are even multiplied actually by the fact that we are in 2025 and everything seems to be moving so very quickly, including and then maybe especially technology. For many, many years, we kind of like went along doing things in the exact same way. And then all these technological advances just seem to have exploded. And we're doing this, trying
Yes.
to catch up. So here's my question. You're an educator, and without putting you on the spot, do you think that we are educate our nurse education is keeping pace with technological advances in healthcare?
I think in some areas we do very well, like with, incorporating simulations and virtual reality is starting to become more common in nursing. In the academic area and in the hospital area, we have simulations. I do think we're still challenged though, because I mean, every day there's something new that's coming out. So I think as an educator, that we have to continually be up to date on what's going on. And then sometimes it's, trying to make sure that we get those tools in place because some things it comes out so fast that we haven't even developed anything on the education side to
Right.
to even match that. So I think it's doing our best in what we have, but I am happy to see that simulations are starting to become more standardized versus maybe like 5+ years ago. It was unusual for to see
Yeah.
simulation at every hospital or every academic place.
Yeah, yeah, yeah. I I agree with you. I look at it, I am pretty much retired now, but I look at it and I think, how are we keeping up? Not that it's a bad thing. I can see the benefits of it. Well, let's talk about that a little bit. Look ahead a little bit, maybe 5, 10 years. What do you think you'll see?
Oh man, I think we're gonna have a lot more AI generated technology. Um, I feel like it's I feel like at that point, actually, I'm actually looking forward to, I think at that point, the technology we have is going to be able to suit healthcare better. I think because technology has advanced so quickly and we haven't really quite kept up, as
Yeah,
people. I feel like sometimes our technology sometimes may be working against us currently. But I think as we grow with technology, that it actually is going to be something that actually helps us with our everyday care that we provide to our patients. And then also on the education side.
yeah, yeah. I would tend to agree with you just because I think that in another 5, 10 years or so, probably the majority of our nurses, or people working in healthcare, not just nurses, might be a little bit more technologically savvy, and able to assimilate some of these changes more easily than the current population we have now.
Exactly, exactly. Because now, as an educator, you look at the different generations that you're teaching. And I will tell you, teaching this newer generation, teaching our older generation, it's completely different. My new generation is like, okay, what kind of, video can I get them involved in to make versus
Yeah,
where my other generation be like, okay, we're gonna write down these notes, and do things, that way. So
yeah,
it's
yeah,
definitely that range that you're gonna have to accommodate to.
yeah,
So
yeah,
definitely in 10
absolutely.
years, I think 10 years it's gonna be all minimum video is going to be a minimum.
I'm excited to see it play out. I really am. Because I can see the benefits of it. I understand that it scares some of us.
Mhm.
Because there are some of us who believe that AI will not just take over our jobs, but will take over our thinking and the way we do things. And we kind of think that if we fit ourselves to understand what's happening,
Mhm.
it would not be that scary.
No,
It would not
I
be
don't
that
think. I
scary.
think it's you know, learning how to work with it and basically use it to our advantage. You know what I'm saying? To basically
Yeah,
assist us in maybe an area that we're weaker in, and especially with, our ratios with patients and the way we take care of our patients, having that, even with, like, when we went to electronic medical records, you
yeah,
know, that changed a whole lot. I'm pretty sure transcription errors went down from writing
yeah,
medications on a piece of paper to now having, barcode scanning. So that itself is an example of how once we adapted to the technology, that it
yeah,
actually helped reduce, you know, errors.
yeah. Yeah. As you talk about transcription errors, I could think of one particular error quite quickly. You got fewer calls from the pharmacy. What is this?
What is on this paper?
Yes. So
I
yeah.
remember those days. Yeah, I was, the paper documentation. So
Yes.
definitely, because I was like,
Yeah.
they're wondering what
And
did you write over on this paper?
what did you what did you write? And so it's soon enough we were able to understand or appreciate. It's easy to appreciate the value of being able to see many things in real time. As opposed to getting stuff in dribs and drabs as you were writing this and then, someone. So I can see the value. But you've worked in several areas. So what drew you to the OR?
So actually, when I first graduated from nursing school, I wanted to go into the operation. I actually when I rotated, all different areas when I was in nursing school, and then I got a chance to actually rotate through the operating room. So basically after I saw that, I was like, kind of where I like seeing how, you take something out, put something back together. And to me, it's like it's the instant gratification. Like, pretty much right after that procedure that you have basically healed somebody. So that
Mhm.
was really nice. But I did spend I guess like 3 or 4 years was first in med surge, taking care of tele patients, oncology patients, ortho, all kinds of patients. Um, and I do think that equipped me to be better operating room nurse because now I understood all the pathophysiology, all the post-op care,
Yes.
everything that was going into, taking care of that patient and understanding that, yes, this is a piece, but, you know, it really helped me think differently. Like, okay, when this patient comes in, okay, this is what they're going to experience afterwards. This is what things they really need to know beforehand because
Hmm.
afterwards
Yeah.
um, they're gonna be trying to recover.
Yeah. Yeah. Awesome. Awesome. Actually, I used to be an ORNS at one point myself, and I loved it. I loved every minute of it.
Yeah.
So, question. What what do you see though? We just talked about challenges for you as particularly, and we talked about technology, but overall, we're talking about a lot of challenges in healthcare. We're talking about nurse burnout. We're talking, about staffing levels and all. What is you think of right now as the biggest challenge in healthcare today from a nurse standpoint?
Um, I will say the nursing shortage is definitely a big concern. I will say compared to before, where you would say more than half of your nurses were veterans, that's not the case anymore.
Mhm.
Um, I could think of some places most nurses are having less than 5 years of experience that are working in the hospital. I think to me that's the most challenging thing. So I think we have to change the way we educate, the way we provide resources, because I mean, gone are the times where most of the nurses on the unit have 15 plus
Mhm.
experience taking care of a patient. And when you think about the different, learning methodologies and things like that, we know that most time you're not an expert until you're at least 5 years, five years in. And so,
Yeah,
knowing that, I think that is a challenge that we're definitely faced with, and I think we still have some room to grow in that area.
we have a lot of room to grow, and for me also that also means that we have to probably educate our patient population, maybe shift a little bit the way we educate our patient population because people come into facilities, for example, into the system, expecting probably the 15-year nurse who and nothing against the 5-year nurse, really. But
No,
the
no,
fact of the matter is 5 years is 5 years and 15 is 15. And in those 15 years, not only have you developed a knowledge, a medical knowledge, but also there's the emotional knowledge of the growing of your own self, um, which, takes a while. Which takes a
Yes.
while and helps you to deal with the things that you're coming up against. So,
Yes. Yeah. And so that's why I said, really and truly having those resources,
yeah,
available to our nurses at that stage, because every nurse wants to feel supported.
yes, yes. Yeah, and every
And when
nurse
nurses
should.
feel supported, we're able to better take care of our patients.
Yeah, yeah, exactly. Now, you started shadowing your aunt.
Mhm.
You had someone to follow. Not everyone does. If someone said to you that they would love to be a nurse, what advice would you give them?
I would tell them, go volunteer. I would tell them that I'm a big advocate for volunteer. I've got a lot of volunteer work. Go volunteer at nursing homes, go to a hospital and volunteer. Because that's how you're going to really know if it's a good fit for you. Also, talk to people that are nurses, ask them about their experience, um, and then once you decide that's what you want to do, start taking, if your high school offers, different programs related to that, start getting interested in those programs. And then go for it. I would say definitely go for it. And the other thing I would tell people is as they're going through nursing school, don't feel like you have to pick your specialty then. Sometimes it's not until after you're a nurse that you kind of move around and you find out what you're good at, you find out where your weaknesses are, you find out that, oh, I thought I loved this, and then you're like,
Yeah.
oh, but but I will tell people that's the beauty of nursing. There are so many different things you can do within nursing. Like when I started nursing empty years ago, I didn't think I was going to be a legal nurse. I didn't think I was going to be doing quality and patient safety and education. um, it's just what my
Yeah.
life led me in that direction, and I realized that's what I like to do.
Yeah, yeah, exactly, exactly. This and as you rightly said, that is the beauty of it. There is a niche. You can find yourself,
Hmm.
wherever you would like to be. There is a place for you within that nursing field. There's a place for you. What would you say though? Well, I'm going to come back to that one, but we talked about, the staffing shortage and all of this. And one of the things that goes along with that is burnout and, lack of care for us. And we complain a lot. Or, well, I don't know if complain is the word, but we observe a lot that um, most of our institutions, we say, don't really care for us. So, what do
And
we
I
do to
hear
care for
that.
ourselves?
I would say the going theme right now is work-life balance. So I would say, flexible scheduling when possible. I think bringing in, in the hospitals, bringing in relaxation sessions, um, having that support, whatever kind of program you may have at your organization is definitely those things that are helpful. Um, and then one thing I always think of is like, becoming friends with your colleagues at work. And doing,
Yeah,
doing different activities outside of work together. So that way we know nursing can be hard. We know caring for people is hard. It's physically and mentally challenging um, work. But I think when we come together and, have fun with each other, I love to see people laughing when when they're at work, because that shows that despite being in a stressful situation that that we can still be there for each other and help each
yeah,
other out.
yeah.
And as I said, the work-life balance is definitely top priority. I always tell people, take your PTO,
Yes. Why do you think you have it?
take it. And I think most places now are starting to have, flexible scheduling.
Yeah,
So with the self-scheduling to allow um, some of that flexibility.
yeah. What do you enjoy doing for you though?
Well, I have two small children, so usually fun looks like to me is a day at the park.
Okay.
Running around at the park is usually what I like to do is get the kids out and run around, do that. And then I like to, of course, to travel. I like to see different cultures, expose the kids to things they've never seen before.
Yes.
I think that's important to, help build character,
Yeah.
to know that things are not always the way, you see things. It gives you a different perspective in life whenever you
Yeah.
travel different places and experience different cultures.
Yeah. Absolutely. Absolutely. And to, I think it's important, especially as these days we have so the ease of communication across the globe, and you have to realize early you don't really live in a bubble. You
Mhm.
you live globally.
Exactly.
Yeah. I have one last question. If you could tell me in one word what you see as the most essential quality of a work of a nurse, what would that word be?
I would say compassion.
Compassion. Mm-hmm.
hmm because I think with the work that we do, you have to show compassion. I mean, that's that's why people feel cared when people feel cared for. And when people feel cared for, they'll open up to you about what's going on.
Yeah.
And that way you can actually properly heal them, not just heal them physically, but emotionally, spiritually, whatever kind of healing that they need. So when you show that compassion, you're able to do that. And then it also makes you do your best that you can for that, for that person, despite the challenges that are going on. So I think without compassion, it's definitely, um, I would say nursing and compassion should definitely always go together.
Yeah, yeah. And that word comes up when I ask that question, that word comes up quite a bit. It tells me that we all recognize that we need that. We have it. We have it. I think we have it. Um, what probably we don't do sometimes is extend that compassion to ourselves and
hmm
even our colleagues. We seem to, be so ready to beat up on ourselves when really we could just give ourselves a little grace. Show the compassion for ourselves, understand that we take it for granted that our work is hard. We know it's hard. We're just gonna go out there and do it. Give yourself a little grace.
We are human.
Yeah, we are human. We are human. Khaleela, thank you so much for this conversation. So very much. I appreciate it. Any last words you'd like to leave us with?
I would just like to thank you for, being able to come on here and talk with other nurses, and hopefully what we share with them, it helps them find their way within their nursing if they haven't found their niche. And then to always, remember that, we're here for ourselves and our patients.
Yeah. Thank you so very, very much indeed. I appreciate it.
Thank you.